Hey, today I'm going to talk to you about intubating a patient with a videolaryngoscope. So there are a couple of different brands out there that you can look at for videolaryngoscopes. But for today's demonstration, we're going to use a GlideScope. So if you're not familiar with that, we'll show you a little bit about it here. Now, a couple of different things that you want to make sure that as you're prepping and you think about going to intubate your patient, you really need to have one, the device in itself, the GlideScope device within itself. It also has blades that are associated with it, and you can have different types of blades. So sometimes there are normal blades or there are hyperangulated blades. It depends on whether you're looking at difficult airway or not. But really what you're looking at is a blade such as this. So you need to have this cable that is connecting to the device within itself, which is giving you your image up on your screen. And then you're also going to have this blade, which you can see it has a light, but it also has a camera on the end, again displaying that image. That's what's coming and displaying that image on the screen that we're going to see here in just a few minutes. The other thing that we're going to look at is obviously you need an endotracheal tube and you need a 10 cc syringe to blow up the cuff on the endotracheal tube. But then we also need a stylet. Now, with most of your videolaryngoscopes, you're going to see usually a stylet that's a little bit more rigid, but it is also shaped. It comes with a device, or you can purchase it with a device, to really emulate the curvature that is expected for placing the endotracheal tube with the GlideScope based on the curvature of the GlideScope blade within itself. And as I said, you can look at it, again, depending on if you have a normal or a hyperangulated blade, you can see here the curvature on your blade. So what are the first steps that we're going to do? Obviously, we're going to induce our patient for a general anesthetic. So we're going to push the medicines like lidocaine, propofol, and rocuronium. As I'd mentioned earlier, as we talk about pushing something for an amnestic and hypnotic agent like propofol, and then our neuromuscular blockade like rocuronium to relax the patient so that we can then have a little bit of an easier time, I guess you could say, in placing the endotracheal tube, right? We won't have them fighting us at that point in time. So once we have now induced our patient, they're unconscious, they have muscle relaxation on board, we're now going to insert this blade in a little bit of a different fashion than what you do with a normal direct laryngoscopy that I've shown in my other videos. So here's what we're going to do. We're now going to take the blade. We're going to then slide it in the airway so we can scissor the mouth open as usual. We can slide it in the airway, but now we're going more midline. And what we usually have is the screen sitting right in front of us over here so that we can watch what we're doing at the same time. Now, for these purposes and for recording, I'm actually going to be looking off screen a little bit because of where I have my screen located for these recording purposes. Now, so what are we going to do here? Now what we're going to do is we're going to slide this in and we're going to start to identify structures. So we can see that obviously we're coming down in here and we're seeing the uvula here is the first structure we're seeing. If we just kind of make a little bit of a lift here, we can see that we're seeing the base of the tongue, and then we're also seeing the epiglottis. Now with this device, because it is also shaped very similar to a Mac blade, we're going to place this into the vallecula. So what we're looking at is the vallecula is this spot right here, which is basically where the base of the tongue and the epiglottis meet in that little spot right there. So once we find it in that vallecula, then we're going to lift up. And that's going to then take, and what that's going to do is, let me reposition just a little bit more. That's going to lift that area up, and then we'll be able to see the vocal cords there, which you can see just right below, and you can see the vocal cords popping up. Then what we're going to do is we're going to take our endotracheal tube, we're going to put it in the oral cavity, and as soon as we get it in the oral cavity past the teeth, we're now going to start looking at the screen to make sure that we're watching where the endotracheal tube goes. And as you can see, I've now got the endotracheal tube going through the cords here. So as soon as I put it and I've got the balloon just past the cords, I'm going to stop at this point in time. I can then now slowly pull my blade out, hold my endotracheal tube here, pull the stylet out, then inflate the cuff. I will inflate the cuff until I can get minimal occlusion pressure, which would now then secure that endotracheal tube. And then I'm going to connect my circuit to it. And at this point also squeeze my reservoir bag. As we mentioned, we're mimicking a circuit in the reservoir back here to see that I've got inflation of both lungs showing that I have securely placed an endotracheal tube in the trachea using this videolaryngoscope technique. So I hope this helped you with understanding videolaryngoscope, and thank you for following me.